For more, we're joined by Professor Arnon Afek, Associate Director General of the Sheba Medical Center, speaking to us from Rosh Hashanah. Professor Afek, thanks for joining us. So maybe just let's look at the good and the bad news. Serious cases down, but if we look at the overall number of new cases on a slightly rising today, and it's still well in the thousands, that's quite above the target numbers we want to be at.
You are right. We are facing quite a complex situation. On one hand, our vaccination program is very, very successful. In fact, the first in the world. And we see its effect. The fact that we have less people dying, the fact that the elderly many of them are vaccinated, but still, totally speaking, we have about a third of the population that received the two vaccines, about more than a half that got the first vaccine only, but still it's very, very effective. On the other hand, we still opened a large part of our economy, and we are going to open Sunday even more. And there we have people who can get infected. So we are trying to vaccinate more people on one hand and to try to prevent the rise in the number of patients, especially hospitalized patients in the healthcare system.
All right, I want to ask you about some of these new variants, especially this New York strain. We heard about the health ministry yesterday saying they've had at least 3 cases, apparently all connected perhaps to the same family. But I spoke to a doctor in New York yesterday who said we really don't know how many people may have this strain, that we're not really, the tests are not necessarily designed to detect this particular one. And there is concern that this new strain may be resistant to some of these, to some degree, to some of the vaccines that have been developed. So how concerned should we now be about that variant spreading in Israel?
Well, we should remember first that that's the way viruses fight. The disease fight the vaccination, try to survive in the environment by mutation, by the creation of new variants. Once these variants have certain advantage over the other or the wild strains, then they spread more than any other else. So we've seen variants, and we'll see variants in the future. And you said also true that it's not 100% resistant to the vaccine or 100% probably affected by the vaccine. So we are going to see different levels of protection by the vaccine toward the different strains. What it means generally is that each year probably we will need to take a new vaccine adapted to the variants that are going to spread during this year. The good news is that both the Pfizer and the Moderna vaccines are very easily amendable, very easily changed, so they can adapt it to the new vaccine.
Right. Now, I do want to ask you, because Sheba is certainly one of those hospitals that's been on the very front lines in Israel of the COVID battle, just the general situation in there, in the hospital at this stage of the pandemic.
Well, the number of, I would say, people with corona that are being hospitalized is on generally diminishing. We have seen less people in our emergency room. Though we still see quite a large number of severe or critically sick patients, there it takes more time for them to heal. Unfortunately, some of them even get better and have no more corona, still remain in a very, very severe condition due to the effects of the corona. For example, we had in Sheba from this December, a patient transferred to us from Nahariya Hospital in the Galilee, and he was on heart and lung machine till last week, where we were able to transplant him. One of the first and only patients in the world who got new lung transplant for his lung who were destroyed by the coronavirus. So this is, although rare, can be the only way we can cure such or help such a person. And I want to thank now on the noble family of the soldier who died, for their donation. Right. They allowed the new life to exist, because the patient before him was 8 months
right.
heart and lung disease in Sheba, but she did not survive, unfortunately.
Right. Well, that is something, an inspiring story, at least on the part of the donors, and glad to hear that. Professor Arnon Afek of the Sheba Medical Center, thank you. Continue to do the good work there at Sheba.